We want to turn now to one of the poorest and least developed countries in the world, Nepal. Almost a third of its population lives on less than $1 a day, and political turmoil has displaced tens of thousands of people. For Nepalese women, life is particularly difficult. The country has a long record of discrimination and exploitation, and maternal mortality in Nepal has historically been among the highest in Asia. Dr. Sangeeta Mishra is trying to change that. She's a gynecologist from Nepal. For the past 11 months, she's been studying public health as a Fulbright Scholar at Johns Hopkins University, and we caught up with Dr. Mishra before she returned to Nepal, and I asked her to explain how women's health issues are addressed there.
These women, they are not coming to the clinics. They don't have access to the hospital. So sitting in a clinic and solving the problem for one-on-one basis, it doesn't work for Nepal.
So some of the specifics, what would you do specifically in Nepal based on what you've learned here in the U.S. at Johns Hopkins?
First thing which I realized the major problem in Nepal was high rate of maternal mortality, and women were dying due to the pregnancy-related complications. Women don't know, they are not aware of pregnancy. They think it's just a normal thing and they can deliver at home, and they are not aware of the consequences that pregnancy can bring in. So I plan to develop a major educational and awareness generation program for these rural women where most of the deaths occur, to aware them about the importance of delivering at hospital or having a skilled help or skilled attendance at home. So that's my plan.
Now, you said most of the women are in the rural areas. Is that right?
Yeah, around 68% women live in rural areas, and if you talk about how many women deliver at hospital, it's just 16%. That's striking.
Yeah.
And there are certain women that can get some help while delivering at the home with nurses and skilled professionals. It's just 24%.
Is there something culturally happening in Nepal that tells women that they don't need to have any sort of assistance or medical attention when they give birth, particularly in the rural areas?
Yeah, it's a part of the culture, because in the family, like mother-in-laws or the mothers, they believe that because they didn't had any complication and they delivered at home, so they think that their daughters-in-law and daughters, they should also deliver at home. What these women don't realize, that they delivered 10 kids at home, but how many were alive? Like out of 10 you have only 4 or 5 kids alive. So now in this era you cannot deliver 10 children and then you have 2 or 3 of them alive. You should have 2 or 3 kids and all of them should be alive. When you see the percentage of babies who die immediately after birth, it is almost 35% of neonatal death in the early period, like in the first 1 month of the life. And one of the most common causes of neonatal death is hypothermia, and the other one is sepsis. So what happens, there are certain practices in Nepal and other South Asian countries, because as I told you, women essentially deliver in houses, so they don't use the clean blades to cut the cord. So there are the chances of getting infection because